It's 7:01. I'd like to call this meeting to order. I guess we can review minutes from the last meeting.
Yep, I don't see any public participation.
Okay.
I
Okay.
do.
Cindy, did you say there was public?
Yep, it looks like Mike Karagi's here from the Wakefield Melrose patch or the patch.
Okay.
I'm just watching I'm not, I don't have anything to say, but thank you.
Okay.
Thank you, Mike.
Thanks, Mike. So I will, maybe we could make a motion to accept the minutes.
Yeah, I guess, I mean, this is easy. It's you or me. I'm just looking at them real quick. I make a motion to accept the minutes from our last meeting of May 9th, 2021, 19th.
And I'll second that. So that's Gorville. This is fun.
I know.
And let's see, then I guess we need to talk about the,
Wait, we didn't vote. We just, so even though I made the motion, we have to vote.
all right, so should I second the motion, I guess?
Yep, and then we'll vote all in favor.
All right, I second the motion. All in favor?
Aye, Gorville.
Aye, Linehan.
Motion carried.
Excellent. And then, let me just pull up the. So, I guess we talked about the reorganization of the board. That happened.
Yeah, so, hey Elaine, how's it going?
You need to unmute, Elaine. Elaine, you're on mute, my dear. Oh boy.
Hold on.
Cindy
So,
muted her. Cindy muted you.
Elaine, can you unmute yourself? Oh.
Cindy, can you unmute her?
I'm gonna try. Back to participants. All right, hold on, Elaine. Unmute. Ask to unmute. So I hit ask to unmute or unmute, mute all, unmute. All right, yes. Now she should be able to unmute. Can you guys hear me?
Yep, but you just muted us all.
Are you muted now?
Oh no, I'm unmuted. Candace is now muted and Elaine is now muted.
I just popped myself off.
Okay, Elaine, you can't pop yourself off?
Weird.
Maybe you should hang up and try to get back in.
Ask to unmute.
Hey, no.
So the options are ask to unmute. Laurel, can you get in as co-host and see?
I got it.
Oh,
Got it. Okay, thank you.
Thank you.
what was it? Okay.
I don't know what she did, but it was great. Everything's going good. It's going good. I
Okay.
showed up for week 3, so they're happy.
It's already been 3 weeks?
Yeah, it was the first week in June, last week. Yeah, this is it. This is my 3rd week, my 3rd Monday. Well, actually, tomorrow will be my 3rd Tuesday.
Okay, so for the public, being that this is the most recent meeting since the retirement of Ruth Clay, should we just have a little synopsis of what's going on now?
What's going on? Well, I am the interim director for both Melrose and Wakefield.
And therefore you are no longer on the board.
I am no longer on the board. I did submit my resignation to the board, and they have that. Everything was cleared.
So that you know, the board did not get the
No.
letter of resignation.
The
And-
council did, town council.
It did,
Yes,
but
they did.
I wrote an email to Administrator Mayo saying that I believe that the board should also have gotten a copy. Just so you know.
Thank you. But that's it. And I'm technically on paper from June 1st to September 3rd, or
Okay.
unless a permanent person is found, which we are hoping for.
Do we have an active search again?
I believe they're in the middle of putting everything together and advertising.
Okay.
That's, the two HRs. I've just had brief conversations. There's been a lot. We also have the difference of Karen Cronin, the public health nurse, will be leaving on the 30th. And we do have a new public health nurse, Melissa Lowry. She started last week on the 7th. Her background is how Melissa actually came in contact with public health was, Laura probably remembers her. She came and volunteered at all our COVID clinics. So she saw public health at its best, as I would say. And she absolutely fell in love.
Our finest hour, I would
Finest,
say.
yeah. And Melissa was extremely impressed with everything and the work that we do. So she was not working at the present time. And she said if there was ever an opportunity for her to, do something in public health, she would like to know. So she heard of Karen leaving. So she applied and she got the job. She's marvelous. She's worked at Mass General inside, been a nurse manager in a lot of programs, and her last job was at Leahy. She also serves on the food pantry here in Wakefield. She lives here in Wakefield. She's wonderful. She's learning a lot. It's her first job in public health, and Karen has been working with her since the first day and will be with her until her last day. So it's good that she's getting a really good, hands-on training. And, Karen is very, very good. And she's doing well. She's almost finished her Maven training. She just needs to take her test. So that's a big thing.
Cool.
She's doing well. She's doing very well.
So we had said the last meeting that we would not reorganize, but you forced us to.
I'm sorry. I'm sorry.
So
The last meeting, we didn't know about this.
so I would make the recommendation that we hold with the order, because I believe Candace was vice chair and I was what we call secretary. So now Candace becomes chair. So we're reorganizing anyways.
Sorry, Candace.
So Candace becomes chair, but we're all in it together, so it's okay. And what's nice is we can individually reach out to the health director, Elaine Silva, and not be, and be, and maintain our relationship in open meeting law. I emailed Administrator Mayo to see if we were obligated to fill the post, being that the hope is that this is temporary. I've not heard back.
And that's a question I had to get to.
Yeah, so Candace, the problem is I can't ask you if it's okay to call him, because that would be breaking open meeting laws. So sometimes we go rogue when we have a small committee. So you do whatever you want in regards to getting a hold of Administrator Mayo or seeking counsel from Tom Mullen. Mullen. I'm working with a new nurse called Cullen, so I just put that out.
Do we need to do anything other than just have it be recorded in the minutes that we're reorganizing? Do we need to
No.
talk to anybody?
Don't believe so. We never have before.
So next on the agenda would be, if we're done with the reorg, do you have to vote on that, or?
Yeah, you should
Okay.
go.
Okay.
Go.
I make a motion to reorganize the board with Candace Linehan as chair and Laurel Gorville as vice chair, with the position of secretary remaining vacant.
I second that. All in favor?
Gorville, aye.
Linehan, aye.
Okay,
So I guess we're on to the emergency order then.
yes, we are.
Okay.
It was kind of nice to look at the minutes. It was so funny, Cindy, I wasn't realizing what minutes I was looking at. And I'm like, why am I looking at March's minutes? I thought we already did this. And then I realized it's March 2020 and you were giving us a little background.
Thank you for that.
Thank you for that.
Welcome.
So, pursuant to the governor's timing in rescinding the state emergency declaration, I make a motion to rescind the public health emergency, which was put in by the town of Wakefield Board of Health on March 18th, 2020, to be rescinded as of midnight tonight.
Midnight tonight?
Midnight, well, it would be the 15th. That would be in concert with the governor. Is that correct?
Yeah, the 15th is when, yep.
Termination actually goes at 12:01 a.m.
Okay.
So we can be consistent and terminate at 12:01.
Yep.
I'll second that motion.
Okay.
All in favor?
Gorville, aye.
Linehan, aye. So moved.
Okay. Elaine, you told us half the health director's report already.
Yeah. I
What
know,
else?
I did.
Anything else?
The only other thing is just I have on the COVID vaccines, the total administered in the town of Wakefield was 3,786. We had 54 homebound vaccines administered. You know, the homebound is now no longer in effect at the local public health, but people can call the number 833-983-0485, and that's with the state, and you can make an appointment with them, and they have their mobile units in the vicinity, and they will come. The other thing is that on the tobacco violations,
Jeez Louise.
Maureen worked very.
New sheriff in town, or the sheriff is back.
Well, no, the whole thing definitely being is the fact that we weren't visible. You know what I mean? There was
Yeah.
nobody visible, and they knew no one was around. So I think everybody was a little bit more lax. I believe 2 of the violations are suspensions.
Yeah.
And the suspensions will have a right to appeal that, and at which time we'd have to have a meeting for that. I don't think we've seen anything yet, right, Cindy? The letters are going out
The certifieds went out today.
today.
Okay.
So Maureen is not done. She's still going to finish up the rest of her tobacco visits and to, check on everyone, and let's hope that there's no more.
So we had 1, 2, 3 first suspensions and for $1,000 and
Right.
3 seconds for 2,000, and only 2 of them include suspensions plus fee, or all 3 of those?
If it was a second violation, it's $2,000 fine and a suspension. One of them was a warning, and the
Okay.
other 3 were first violations for $1,000.
Okay. I was running through them all really quickly just before we started. I was like, oh, wait a minute, there's suspensions here. Okay. Thank you.
You're welcome.
So that's where it is. And I believe Cindy had the spreadsheet done of the
Yep.
grants to get you aware. That grant for the excellence grant, we will be finishing up this week to put everything together. The deliverables are due the end of the month. We will be hiring 3 people since the fiscal part is in Wakefield. They will be Wakefield employees. We will be meeting tomorrow with the others in the coalition that we have. That's Medford, Malden, Winchester, Stoneham, and us, right? 5, is that all of us?
6.
6. So we'll all be meeting tomorrow to review the job descriptions and the detail to put this grant into effect. And there will be a full-time grant person who will manage it and manage those employees. We're
And
looking forward to it.
And it's being housed in Wakefield?
Yes, the grant person, the head of the thing will be housed in Wakefield in the health department, most likely in the new office. We'll have a spot for them. And we're not quite sure, but the communications person and the grant person and the inspector, there is a spot in Stoneham for them. They have a spot put aside for them so that they will be there, but the person here in Wakefield will oversee them.
Wow.
It's a big grant. It's very confusing.
And thank you to Catherine Dingra for the full spreadsheet of what we're going.
Yes.
So is this on our grid for all of our grants? Is this called the MVPHC Shared Services Grant? Or is this yet another one? No, yes, it is. So it's the excellence. We should probably call it the excellence grant.
I agree. I think that's what the state's calling it, but they kept wording it. It definitely was called the Public Health Excellence Grant. But because it's the same coalition, the Mystic Valley Public, but it's definitely different than that. So to not get them confused, we should probably word what they can figure that out, I suppose.
Yeah, we'll make sure.
So looking at the spreadsheet, the
Yep.
fourth, so we have drug-free communities, federal CDC is number 1, Melrose Wakefield Behavioral, we talk about that, that's number 2, Mass in Motion, number 3, the shared service grant, that is the excellence or that is not the excellence?
Is it 300,000?
Yes.
Yeah.
That's the excellence
That's the
grant.
excellence. Then tobacco, then substance use prevention through the state, which is with Elizabeth Parsons.
Yes.
So it's awesome to have a visual of this. I just printed it up to make it all fit to one page, but I did leave it in color. Looks very nice. So by my count, we have a good chunk of grants.
Yes.
That's awesome. I think they exceed the budget for the Board of Health just to run the health department. I can't remember what that number is.
Actually, that SAPSI with Elizabeth will be transferred over to Medford.
Oh, is that right?
First, and there'll be a new full-time substance abuse person hired through the city of Melrose.
Wait a minute. And what, so the BSAS is with Medford already.
Mm-hmm.
What's going to Melrose? Are they getting their own drug-free?
Yes.
Okay. I'll try to stay out of that business.
It's,
So
it's very, it's
Yeah.
confusing. It's very,
Yeah.
very confusing. If you think it's confusing, you should be me.
who is our lead on? Oh, it's Kara and Catherine for the Melrose Wakefield Behavioral Health.
Mm-hmm. Yes, that's correct.
I'm looking forward to that. So we need to get moving on some kind of action plan with that. So I look forward to that. I've had some conversations with people saying, you know, there's lots of people in town who kind of misunderstand folks who are, so this is a grant that's really kind of an anti-stigma. Maybe that's what I'm going to nickname it. Stigma for mental health and how we can engage. And so what I've always hoped is that we could be better neighbors to folks who are residing in group homes with significant mental health challenges, and that we can actually reach out to them and be neighbors as opposed to kind of us and them, which is what I feel like it is right now. And just a shout out to our police department once again, because they have always been really collaborative with the leadership in those group homes. To my understanding, I believe many are managed by Elliott, but maybe this grant will help us identify that as well.
I think it will. I think that Catherine and Kara both have some, it's so good at everything and some really good plans. And once this really gets up and going, I think that they'll put it into effect. Maybe if the board, that maybe they could write something up for our next meeting once they really start this, to let you know what they possibly are going to accomplish, what their plan is. They have 4 hours a week each.
Oh, is that right?
Yeah.
Good to know. So 8 hours total?
Yeah, I believe it is 8 total, because I know Karis has 4. I will check with the Catherine. I'm in Wakefield again tomorrow.
Okay. How's the commute, Elaine?
The commute is easy. It depends on if I hit the lights. I'm near at either place within 6 to 7 minutes. Depends if I hit the lights, either at North Ave or I hit
Yeah.
the lights at the Fellsway. I got it down packed. Great.
I have to bring my car into service at least a month earlier than it was supposed to, because I've suddenly been putting 400 miles a week on my car. Art.
Commute is extremely, very, very easy. I'm not used to that easy of a commute.
I know. Good for you.
And it works out well. We're very, very fortunate in both communities to have great, great staffs in both offices. You know, like Cindy's been around and working with them, and they're just so good and so helpful. They're very, very helpful and helping me a lot of them. They're very, very good. And I did see Ruth today. She came today just for a quick visit. She was in Melrose at City Hall, and she came in to see me for a few minutes. So we kind of caught
Does
up.
she look an inch taller because she's not compressed?
I told her I thought she looked great. She said, "Really?" Already showing. So she was good. She's very good. I don't really have much more except for, it's only been the 3 weeks. It's the end of the fiscal year, and in trying to get that all done and everybody kind of shimmied up on all the grants and then everything to accept the new budgets. And it's a little confusing. At times to me, it's a little bit different than what I was used to, but mostly the grant people in the offices are very, very good. And Cindy and our clerk Denise in Melrose is very good. So we're getting it. It'll get there. It's okay. We'll be there.
All right.
Should we plan next meeting?
I think so, because it sounds like we're going to end up having hearings. So
you can wait if you want to, or, the in-person meeting thing is the biggest thing, as you know. As of the 15th, everyone's supposed to be able to come back into in-person meetings. I'm waiting for Wakefield to decide, where they're going to be, because the big thing with the Zoom meetings was that it allowed so many of the public to participate and listen to council meetings and to board meetings. So what they're saying is they want us to present a meeting location that is open and accessible to the public.
Why can't we do a hybrid like they have always done for a school committee?
I believe
and let, like we can be in the room, but we can have Zoom participation.
I think they're trying to set up a room in Wakefield so that can happen. So you can have the conference calling or whatever they'll be able to have, a WebEx, and somebody call in. And it also will be able to, they're coming out the state with a little bit more fine tuning on a lot of things tomorrow. And one of them is that, because that will also allow your chairs, I believe, to say that, like, there's only 2 of us that could be there in public, then, and then the third person may be somewhere stranded or be away and be able to join us, via video conference. So that's something really, really good. I'm glad about that. Or it'll help us on a snowy night, I think, to go.
Yes,
fully.
we have had some of those. I know.
Yeah, we have. So
Yeah.
that's what we're going to do. So we're going to wait.
Not to mention vaccine clinics.
Yeah, well, that was definitely. So once I believe town council is meeting this week, I'm going to check tomorrow and
They're
see.
meeting right now. Yeah,
Is it now? Yeah,
Yeah.
I couldn't remember.
Monday night.
It's a little difficult when you get between two of them too. You can't remember who's who.
I know. And Candace, are you able to reach out to town council with any concerns or updates?
How, like, what do you mean?
So you just pick up the phone and call Julie if you ever, just want to bend her ear about anything that you're concerned about, or if you want guidance on how they're managing things.
Julie and Jonathan and Mayrene's contact info.
Yep.
So yeah, I'm comfortable reaching out to them if I need to.
Good. I mean, sometimes it's just things get done on a chair to chair basis. So it's kind of nice. Okay. So we could either do July 21st, which is the third Wednesday. I don't have any booked Wednesdays.
I could do the 21st.
Okay. 7 p.m.
7 p.m.
Okay.
Elaine, is that good for you?
Oh yeah, I have no life. So. Sure, 21st sounds good to me. And then if we really don't have anything, we probably won't have to if we don't have any hearings or anything. And all depends too tomorrow on what comes out with the governor. There's so many little things in regards to the emergency declaration, and is he going to extend, or what's he going to expand on, and things like that. There's some talk about what will come out, so we may have to meet to just review.
So we're going to start getting bombarded with, so what does it mean when we rescind this order? So just right off the top on masking, it seems to me that it's really up to the store then to decide whether or not they want patrons to mask. Mm-hmm. I hope that doesn't make things confusing, because I like the idea of masking. I have to say, I had someone at a Subway in a different town putting a sandwich together without a mask, and I thought, for people who are like preparing food, I kind of think we should keep masks like forever. I just was like, oh.
But you'll also be required, masks are also going to be still required in any kind of hospital setting, medical setting, on public transportation, and in the schools until the end of the school year. The DOE had put that in, which I think is really good. And then they will decide sometime in August what will be coming back. And we'll see how the vaccinated and employers, that equal opportunity is saying that employers will have the right to ask their employees if they are vaccinated.
Right.
They will not be able to, release that information, but they have the right to ask that. And I guess there's a few places across the country already having some difficulty. And one thing is to remind people, if you have your vaccination record, take copies of it, put it in your phone, because a lot of people are coming in requesting that. And that's, involves some time to go back into the MIIS, and if that's down.
I'm going to take a picture of mine right now if I haven't already.
I have mine.
To do that.
I transferred because we gave people 2 cards. Oh, so I have 2 cards.
Take a picture of your family members too, just in case they're not
I know.
keeping hold of theirs.
Well, I'm traveling, so that's a good idea. Have my little picture of it.
Yeah, I'm going to be traveling. I haven't been asked for it, but I did meet people today who were going to someplace, and they were going to ask to bring their card with them.
Okay, good to know. All right, I got nothing else.
Anybody else?
No.
I'll take a motion to close the meeting.
I make a motion to close the meeting at 7:30 p.m. And I thank Elaine for jumping into the interim position for now.
For now. You got that line for now?
Good luck, Elaine.
I'm hoping it's not as bad. It's confusing. It's different. It's nice. But if I can help, this is what I can do. I feel bad I left you too. But hopefully we will be able to find a very suitable director. Someone will come along and that will be the best thing.
Yeah. And Laurel, if you get any response from Steve about plans.
Yes, I'll tell him to call you.
Yeah.
Absolutely.
Okay. Thank you very much, everyone. Have a great
Okay.
couple of weeks.
Meeting adjourned. Thank you.
Thank you, Cindy.
You're welcome. Good night.
See you tomorrow.
See you tomorrow.